Hello. Check.
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 Okay. Very good morning to all of you. And on behalf of Mobility India, it's a pleasure to invite everyone on this auspicious occasion. Today, as you all know, November 5th, we are here to witness the first International Prosthetics and Orthotics Day. And this date corresponds to the date ISPO, which was established in 1970. So on this day, we are celebrating it today. So on this important occasion, we have very important dignitaries who are joining with us, few of them through the virtual, and we also have our guests present with us today. And first of all, I would like to invite Mr. Claude Tardif. I think Nayas is online. Yeah. Welcome, Mr. Claude. He's a president, International Society for Prosthetics and Orthotics, Belgium, and he's a consultant rehabilitation and assistive technology, former head of physical rehabilitation program, ICRC. We welcome you, Claude, for this day. And next, I would also like to invite Dr. Madhavraj, the national president, the Orthotics and Prosthetic Association of India, as well as president of International Society for Prosthetics and Orthotics India. He is also the member of BIS for rehabilitation equipments and proprietor for RR Remedies since 1980. We welcome you, sir. I request Dr. Madhavraj to go to the dais. Can Chandini please escort him? And I request Ms. Chandini to hand over the bouquet to Dr. Madhavraj. Thank you, Chandini. Thank you, sir. Next, I would like to call upon Mr. Navid Dadbin. I think he's joining with us virtually. Okay. Then next, I would like to invite our beloved Executive Director, Albina Shankar, to come on to the dais. Thank you, Raju, for the escort. I request Ms. Sudipta to hand over the bouquet to Albina ma'am. Thank you, Sudipta. Next, I would like to invite our beloved Academics Director, Ms. Ritu Ghosh, Head of the Education and Research Unit at Mobility. Raj for the escort. I request Ms. Raghavi to hand over the bouquet to Ritu ma'am. Thank you, Raghavi. And welcome all our staff, students, CRE participants. And we also have some delegates who have joined. Sukhdev from PS Nepal President, Zia from Pakistan, Imran from Bangladesh, who are all joining with us virtually. Have joined with us virtually. Welcome all. Okay, so to start the day, I request everyone to please stand for the national anthem. Thank you. Please be seated. Now I request our Executive Director of Mobility India, Ms. Albina Shankar, for the welcome address.
Good morning to everybody here, and a very, very warm welcome to Dr. Madhav here. And it is a great occasion, and you being here has made a lot of difference to us. And thank you very much. I think that's where, when we were speaking, I said you had to go to Delhi, but then I think you were destined to be at MI today. So thank you very much, sir. And congratulations to all the prosthetists and orthotists of Mobility India and across the country, across the world. It's the first International Prosthetics and Orthotics Day. So I was just thinking about 28 years back when Mobility India wanted to establish Mobility India, when we wanted to establish Mobility India 28 years back, the first objective was there was hardly any services, rehabilitation services in rural part of India. So that's how we started. And then we thought it's a great need. So people have to access to those services. And that's where MI began with. And we started doing a lot of awareness on the need and benefit of rehab services. And we felt, especially in the rural areas, the access was very, very limited. So that's how it started. And it's a great honor. It was established by a prosthetist and orthotist, Mr. Chapel Kasnabis, who was the founder director, who's presently at WHO heading the 80. And today you'll be hearing him. And he's also made a wonderful, real, great difference in the world in terms of health, prosthetics and orthotics, and assistive technology. So when we started MI, I remember that, to get a P&O was quite difficult. So the first lady prosthetist and orthotist, she's here today, sitting on the dais, and that's Ritu Ghosh. And to get women was very, very difficult. So I remember Ritu, the first, when she came here, she was the first P&O, a woman, and there was a huge need for women technicians at that time. Most of the women in the rural areas across were not accessing the services because they had to be assessed, measured by a male technician. So the objective of the organization was very clear. We had to train more of women. And if I see today, I see so many women technicians here in MI and across, and MI's trained also many women across India and across the developing countries as well. And there are more women with disabilities, children with disabilities who are now able to access services. I think 28 years, Emma has done a wonderful work. It's awesome. I feel very proud. I'm a part of it right from the day one. And I've seen so many people, what difference it makes to have good quality devices delivered to them by the professionals who are very kind and whose behavior is very good, the attitude. It makes a lot of difference. So MI has made a lot of changes across the country, across rural areas, villages across, made a lot of changes. I think it's a prosthetics and orthotics as well, but then MI has also included the therapy. Like if you see today, it all has to go hand in hand, the professions. Yes, P&O is very, very important. You make a lot of difference, but then a team approach, multidisciplinary approach is also very good. So that's how MI is. And there's so much of need still. And like the way the theme is today, it is enabling and empowering. So when I look at it, I see that a lot of things MI has done in its work, enabling people to have access to good quality services across, even in the villages, remotest villages, and empowering people, children with disabilities, to access the service and go to school, have a good education, have a good livelihood. It is both for children, women, as well as older people. So the theme of today, it's blends so well even in what MI does, enabling and empowering. So if I see many of the people over here, even the staff, students, people with disabilities, you see they are able to access services, and empowerment is something that we always believe that it is very important tool for a person to perform or a person to ask also for. We talk about rights, it does not mean people are fighting for the rights. I think once you're empowered, once they know that it is available, I think it's for them to know. So it's so nice to have a very great day today. It is. You'll have many speakers who would be talking about that. Wishing you all good luck in your career. There's more to be done, and there's plenty. The access is huge demand, and wishing you all a very, very happy International Day, P&O Day, and wishing the day also full of success, because you'll be having many speakers who would be speaking in their experiences across the world, what it means to be a real prosthetic and orthotic professionals. So congratulations, well done to all the P&Os of MI, both now present as well as the past, who has made a lot of difference to us. Thank you very much.
Thank you, Albina ma'am, for recollecting the past memories, and also good to know that Ritu ma'am, the first women P&O at Mobility India. And I think now we have grown so much, and so much workforce has been developed further. So thank you all. And now next, I would like to call upon our academics director, Ms. Ritu Ghosh, to address the gathering.
Good morning to everyone. Good morning, our chief guest, Claude Tardif, who's uh, who's in online available with us, and Mr. Navid, he from ICRC. He has not been able to make it because he's busy in a sports activity of ICRC. So he's in a stadium, and so he couldn't join, but he has sent his best wishes to all of us for this important day. Our guest of honor, Shri Madhuraj, thank you for coming. Our executive director, Albina Shankar, and the participants uh, from across the country, as well as those who are on the online. A very good morning to everyone. And special, can I just see who's on that online actually? Is it possible? Yeah. Yeah, so I also like to welcome Mr. Jia, ISPO President from Pakistan. Hi, Jia. I would also like to welcome Prosthetic Orthotics Society of Prosthetics Orthotics in Nepal, President Mr. Sukhdev. Are you online, Mr. Sukhdev?
Yes, ma'am. Namaste. Good morning.
Namaste. And I would also like to welcome Vice President, Prosthetic Orthotic Society of Nepal, Mr. Yati Raj. Are you available online, Yati?
Yes, ma'am. I'm available. Thank you.
And all the participants online, as well as the present here, as well as our fellow professionals, physiotherapists, prosthetists and orthotists, social worker, community workers, all the members present in the hall. So Vanilla has asked me to share few words. Prosthetist, orthotist, women in Mobility India. I think it would be nice for me to share on this special occasion. When I completed this prosthetic orthotic course way back in 97 volunteer in an organization which was led by a British woman, and it was a very comprehensive setup. And as a volunteer, I got 100 rupees per month as a stipend. You know, now the way you all get excited getting the stipend, it was same with me for 3 months. And for me, those 300 rupee in my hand, it was almost like a lakh. I was so happy. Today's scenario and that time scenario was very different. When we joined, I was not aware which profession I'm joining in, because my uncle, who left India almost 45 years back to US, he was asked, you know, what is this course? And he said, it's a fantastic course, and Ritu must. No, we listen to elder. So I listened to my parents listened to him, to my uncle, and that's why I joined this profession, as by chance or by the input from my uncle and my family member. That time, the scope of Sri Madhuraj may know that time scenario was very difficult. I realized that the scope was very limited. But what it kept me going, which is with many of you here, that you know the satisfaction what you get after fitment of prosthetic or orthotic devices. And I thought I must complete this. Now today, on the occasion of first International Prosthetic Orthotic Day, when I look back and I look today, what I am today, you know, the kind of a role I have played in last 26 to 27 years, it feels great. It really makes me feel proud that what I am today. So I attribute this profession of prosthetics and orthotic for what I am today. If I was not a prosthetist and orthotist, I'm not sure I would have lost in a crowd. With respect to all the profession, I would have lost in the crowd of an engineer, or I would have lost in a crowd of a doctor, maybe finance experts. My father wanted me to become a finance expert. So maybe I would have lost in a crowd. But today, because of this profession, I think I stand in a crowd. I am known locally, I'm known nationally, and I am known globally. And this, on this important occasion of today, I think I mark this today's special day for all the prosthetists and orthotists across the world and of my teachers. So I think with this note, I thank everyone who has contributed in developing or working with me and contributing my development, internal stakeholders, external stakeholders. There are many individuals, family members. I think I cannot take the name, but I think everyone knows that whom I meant. So I think thank you for, thank you to everyone. And I really feel proud of this profession, what has made me today. So thank you, everyone.
Thank you, ma'am, for that inspiring speech. And I think, hope you all will be proud being a prosthetist and orthotist and celebrating the important occasion today. So now we'll move on to the next program. We'll go for the lamp lighting. I request all the dignitaries on the dais for the lamp lighting. I request Ms. Minakshi to assist. I would also like to call Mr. Sanjay Oyanam, Mr. Raju,
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य
Thank you all.
नास्ति दरिद्रः
Okay, we are waiting for the very important on the great moment of the day where we are launching the International Prosthetics and Orthotics Day, for which I would like to invite Mr. Claude Tardif, President, International Society of Prosthetics and Orthotics, to launch the video.
It's me. We have to launch the video, or you can launch it on your side. Can you hear
Claude,
me?
we will, after the release of the video, we will hear from you.
Okay. Can you hear?
Thank
Can
you.
you hear me? Yeah.
We can hear you, Claude. Yeah.
Okay. Thank you.
Yeah. Can we give a big round of applause? Prosthetics and Orthotics Day celebrating at Mobility India today. Okay, now we will like to hear from ISPO President, Mr. Claude Tardif. So we request you to share on the role of prosthetics, orthotics in human development. Over to you, Claude.
Okay. Thank you. And I hope you all see my screen or my presentation on your screen.
Yeah, we can see the presentation.
Okay. Good. So thank you all. It's always a pleasure to be with Mobility India. I even thought that I didn't visit Mobility India for quite a while now because of the pandemic and because for whatever reason. But it is always a pleasure to participate in an event organized by Mobility India. And I was a bit smiling when I was hearing Ritu explaining how she came into the profession because it is, I will say, the same pathway that many people, and I think it is important, and it's also important to raise the fact that when I started as a prosthetist orthotist, the profession was mainly a men profession, and now when I travel around the world, when I see most of the training institution, more than, I would say, depending on the country, but between I would say between 60 and 70% to 80% in some cases that students are women, which is good for many reasons because it's also uh, like it's represented, but it's also for many society giving the possibility to women, children, adult men to have access to services. So. But it was nice, and and I know Chapal is speaking later today. I spoke to him this week from Geneva, okay, and I know he will speak to you. And I think everybody, not only Chapal, but everybody at Mobility India have done quite a good job to ensure that whoever need access to prosthetic and orthotic services will have access to it, to the different project and program that Mobility India is running. And I think it is important to talk about prosthetic and orthotic and why we at ISPO we have decided to launch this first International Prosthetic and Orthotic Day. It is the first one. It was launched today on the 5th of November because it was the date that ISPO International created back more than 50 years ago. Okay, and this why did we decide that it was important International Prosthetic and Orthotic Day? Because first of all, there are some number. Okay, at the moment, WHO estimate that 0.5% of the population, of the total population, will need access or will require access to prosthetic and orthotic services. And when I say services, it's cover everything. From the moment the person is could be assessed by a medical team, then to be taken care by a multidisciplinary team, to make sure that it's not only the provision of the device, but it's also accessing the therapy around, the required therapy around, that make to ensure an optimal use of the device. But at the moment, WHO has estimated 0.5%. But the population increasing, with the increasing in the aging population, with increasing with non-communicable disease and musculoskeletal condition, did that by the end of this century, there will be approximately 1% of the total population that need access to services, prosthetic and orthotic services. However, it is estimated that only 5 to 15% of the people who need this type of services have access to it. So it's a huge, there's a huge, I would say, a huge work to be done to ensure that more people can have access to not only prosthetic and orthotic services, but to quality prosthetic and orthotic services, which is important because so even in all the country around the world, accessing prosthetic and orthotic is sometimes difficult. And we all know, following the publication of the global report on assistive technology, that there are different challenges, and the main barrier for people for accessing prosthetic remain the cost of the services, the lack of these services, the lack of professional, the lack of service provider. So they all think that can be working on, and an institution like Mobility India is working on all these different barriers to try to overcome the barrier for people from India, but also I know there are some people who are trained from other countries around the world, okay, that come to Mobility India, but cannot be solved by one person. It cannot be solved by one organization. It's need a global answer, okay, to make sure that everybody work on the same direction and try to achieve the same objective. So why an international, to raise the importance and the impact of prosthetic and orthotic services for those who need this type of services, and to raise the importance that if we want to reach the point where no one is left behind, okay, that everyone can participate in the society, okay, they need to be further or more resources allocated to develop appropriate and equitable access to prosthetic and orthotic services. So, and as it has been said before, okay, so the main theme of the International Prosthetic and Orthotic Day is enabling and empowering. Enabling because access to prosthetic and orthotic services allow people to and to live a dignified life, and to learn, work, and take part of the society and the development of the country. You could, I'm sure, there's quite a lot of people in Mobility India, that people who had access to prosthetic and orthotic services and now been able to work at Mobility India, to learn the profession of Mobility India, or even to learn another profession like physical therapist or whatever. But it's a good example that how prosthetic and orthotic enable enable people. And I'm sure that also my colleagues and friends from Pakistan, from Bangladesh, from Nepal, I'm sure they also have a lot of examples how access to prosthetic have been enabling people in their own country, on the different country, to make sure that they were able to be an active member of the society. Orthotic, prosthetic and orthotic day also is an empower tool. Okay, so because it's provide the opportunity to determine your own future and to fully participate in community life. So that was just an introduction of why we have decided to launch for the first time today, but it will come back every the International Prosthetic Day. And I'm quite happy to see that many countries are doing different type of events to mark that day. So I'm speaking to you from Jordan, where I will participate in a meeting of prosthetic of people involved in prosthetic and orthotic services from different countries, from the region. And it's nice to see that that Mobility India is doing something, and it will be the same in different country. And I see my friends from Pakistan is quite active on social media, and I can see that he have made quite a lot of good messages on social media about that day. So prosthetic and orthotic in human development, that was the uh, the content of the presentation. I think we need to understand what is human development. So human development, the definition or the concept of human development, it's about giving people more freedom and opportunity to live life they value. Okay, so it's more to really allow people to choose what they want to do, and the opportunity and the capacity and the opportunity to do what they want to do. So there's two type of, I would say, there's two dimension. Okay, enhancing human ability. So by providing by providing a prosthetic and orthotic, we increase the ability of people, and we and access to prosthetic and orthotic services. It's only it's a tool. Okay, it's a tool to make sure that people will be able to do something. You know, if you receive a lower limb prosthetic, then you will be able to walk, and you will be able to reach your work, or to reach your school, or to reach your university. Okay. And at the same time, we need to create conditions for human development. And then that's the importance of again, prosthetic and not to create a condition, but also to make sure that the I would say the community is also accessible. We talk here about universal design, for example, okay, and the fact that more women, more children have access to services, allowing creating for them also a condition for them to develop and to have their own life the way they would like to do. So prosthetic orthotic is also a human right. Okay, so the Universal Declaration of Human Rights, okay, which is above the Convention on the Right of Person with Disability, said that everyone is entitled to healthcare and social services that provide equality of opportunity for people to enjoy the highest attainable level of health, and prosthetic or orthotic services is an integral part of such services. And again, the UN Convention on the Right of Person with Disability requires state, okay, and this is important, okay. It's a state responsibility to make sure that prosthetic and orthotic and other assistive technology are available for people with disability, so they can go to school, they can work, they can shopping, they can participate in the society. And if this is very important, it is a state responsibility, at least for those who have ratified the UN Convention on the Rights of Persons with Disability. It doesn't mean that they have to be service provider, but they have to make sure that the prosthetic and orthotic are available in the country. So access to prosthetic and orthotic is a life changer. Okay. As for the other assistive technology, it's helping uh, people in needs of all aspects of their life. A child can go to school, okay, make friends, participate in sport. And I was hearing that Navid, my former colleague from ICRC, okay, was participating in sport events, okay, and the prosthetic and orthotic allow people to make sport, okay, child, okay, normal sport, but you can have also high-level athletes, okay, which can continue to run, and we see them in Paralympic that because they receive prosthetic and orthotic, they are able to do sport, high-level sport. An adult can be independent, can have access to a higher education, job, carry out for household activity, and participate in social life. Okay, meaning that he can do whatever he wants within his community, being able to actively support the activity of the community, maybe the leader of the community also, if they want to. So prosthetic and orthotic products further increase user well-being, self-esteem, self-image, and the motivation to pursue important life. Okay. without prosthetic, okay, and orthotic. And this is the other side of it. Remember that there's only a small percentage of of those in need um, who have access to prosthetic and orthotic services. Okay, so without prosthesis and orthosis, people may suffer exclusion, be at risk of isolation, and live in poverty. And I think this is very important. Okay, that people uh, may not go out of the poverty cycle because they do not have access to prosthetic and orthotic. In terms for responsibility for public policy, those who made public leader, okay, that access to prosthetic and orthotic, okay, uh, enable people to live better, but be more productive, participate in the economy of the society, be more independent, and live and learn, walk, etc., etc., etc. So, so we have to see access to prosthetic and orthotic as um, not only as an impact on the life of the people, of the well-being of the people, but also economic benefits, such as reducing the health and welfare costs. And for the state, it may be important, okay, because it's reduced the level of support needed uh, to be provided to the people to by the state, okay. But it's also for the state, okay, by providing access to it, or to make sure that prosthetic and orthotic access is available and accessible, because there's two things. Okay, people can be more productive, and people can work, can gain income, pay taxes, etc., etc., etc. So when you look at the overall role of prosthetic and orthotic in human development, so we can say that support students at any age in enjoying their right to education and being successful and included at school, in vocational training or higher education, open up opportunity for people with functional difficulty to participate, raise their household income, and become entrepreneur if they wish. Okay. Prosthetic and orthotic services support people with mobility difficulty in participating in physical activity and sport. And prosthetic and orthotic products support people with mobility difficulty uh, in everyday activity to increase their well-being, independence, and safety. So social benefit, sorry, social benefit for, as I said before, so prosthetic and orthotic can help increase employee productivity. Okay, if you are able to move, okay, we can help, and then can also help. So meaning that the company or employer uh, see a more productivity of their business. Okay, but also by keeping people at work, it's also employee that they can return people who are qualified. Okay, access to prosthetic and orthotic can have a significant effect on the lifetime earning potential. Okay, I think, as I said before, if you're able to go to work, okay, and gain an income, so you may in your life, or even to have access to higher education, okay, in your life can change, and your income over the your life curves can increase, okay, with your family, not only your close family, but the entire family. You can be I would say somebody that can lead the society and new products and become very, very successful in your business. And it's have been proven that if you invest $1, okay, in prosthetic, $9 to user, to family, and to national community. So you can see there's a good investment, or good reason to invest in prosthetic and orthotic with a return on your investment to 1 to 9. Okay. So to conclude, I would say that the positive impact of prosthetic and orthotic services go far from beyond improving the health, well-being, participating, and inclusion of the individual and their family and society. Okay. But also, I think it's important, and I think when we try to convince state, public authority, even private entities to invest more in prosthetic and orthotic, we need to be able to explain to them that the economy shall benefit. Okay, make the case for investing in prosthetic and orthotic services. Okay, very interesting, and it's not a charity. Okay, it is a human right to have access to prosthetic and orthotic. It is the role of the state to make sure that prosthetic and orthotic is available. Okay, and normally they should also their role to make sure that it's accessible to the whoever need it and whenever they need it. So I would like to finish my presentation by inviting you to the ISPO World Congress that will be held in Guadalajara in Mexico in April 2023 from 24 to 27. And the theme of the Congress is the art and the science. And I think Ritu spoke a bit earlier about um, being involved at a local, national, and global level. Okay, but this type of Congress, okay, give you access to a lot of information, give you access the possibility to exchange with your colleagues, not only in India but from all over the world, and it's quite an important. Well, it is the biggest. Okay, it is the main event for prosthetic and orthotic services. So. And I know it's far away. I know it's expensive, but I'm inviting you all to come and try to do your best to participate in this Congress. So thank you for your attention. I don't know if there's any question. I remain available for everybody. So thank you very much and have a good day. And let's celebrate together, not only prosthetic, the entire prosthetic and orthotic service, I would say, world, which include prosthetic and orthotic, prosthetics and orthotics, but also other profession, the user, the community, the industry, everybody who is moving around prosthetic and orthotic services. Thank you all, and I wishing you a very good day. Thank you.
Thank you, Claude. I think now it's open for questions. So if any questions from the audience, or if there is any questions for the participants in online. I think, can you please, Gandhi? Can you pass mic to Ritu ma'am?
Claude, thank you for your wonderful presentation and thank you for being here today with us. As you said, we are not only in India, we are celebrating, I think this is a regional celebration. We have people from Pakistan, we have people from representative of society from Nepal, and we might expect soon from Bangladesh. So my question here is that now it took so many years to come up to celebrate the first International Prosthetic Orthotic Day. So how do you see we crossed various milestones in last so many decades? What as per your perspective, how do we see the coming milestone after this? Because this day will really bring lot of awareness and it will raise awareness in various communities. So, what do you say that, what kind of a milestone we expect? It's a very open question, Scott, but
it's a very it's a wide question, and I will try to be to give you a wide answer, but not too. I think the next milestone is uh, decision maker being more recognizing the role, the positive impact of prosthetic and orthotic. I think this because without their support, it's very difficult to have the sector moving forward. Because if you look at the logo, of the International Prosthetic and Orthotic Day, okay, there's 5. You have the O in the middle, okay, and then there's 5 bars. Among these 5 bars, 4 are linked to the pillars that need to be addressed to ensure that prosthetic and orthotic and appropriately access to everybody. So we need to talk about policy, we need to talk about products, we need to talk about personnel and the provision of services. And without the support from government, from industry, when I say the industry is the manufacturer, without the support of the different profession around, okay, and mostly from prosthetic and orthotics, okay, and also from the user. And all together, we should be able to move the files for prosthetic and orthotic. And as you said, Ritu, the sector has been changed quite a lot in the last 25 years, okay, and the next big milestone, I will say that it first of all, people, even those who do not need prosthetic and orthotic, okay, will know what it is and will understand the importance of supporting or raising the voice, okay, to make sure that this is available for everybody. I hope I answer your uh, your question, Ritu. It's quite a large question, and it's difficult to find. Okay, and I think, but it's also contextual. But for me, at international level, okay, I would say, if we were able to make people, the state, the government, okay, recognizing the positive role of accessing, provide the necessary support for the sector to develop, okay, then we will have reached quite an important milestone.
Yeah, thanks, Claude. I think it was not a very wide response. I think it was a very specific, because yesterday we had a panel discussion, because in these 2 days CRE program and the celebration, we have intensively involved various stakeholders, and the people are the key. So like today we will have 2 individual speakers. The user will highlight their expectations and views. Yesterday we had the panel discussion on prosthetic, orthotic, and older population, for geriatric population, and in our audience they are there, so the users are also listening to you, Claude. Yesterday there was a very key messages came after the panel discussion, that what you're saying about the government, the users, even the professionals, they're not aware of the government schemes and government policies, what are existing, and how they need to take a proactive role, as you said, the decision maker and all. And then today we'll have another panel discussion where the researchers, innovators, and educators, professional bodies, we have Sri Madhuraj here, so he will also be involved. So I think a more collaborative approach I think that would be also the important milestone for us to take it forward. So over to, so thanks, Claude, and over to Vanilla to take it forward.
Thank you, Ritu, and you're right. I think there's 2 questions from people on the internet. Yeah. So.
Yes. Am I audible?
Yes.
Hello. Good morning, sir. Thank you for your nice presentation. I have no questions, only suggestions. In 52 years of journey, we have got our first day of recognition, and in that, as per the declarations of the Millennium Development Goals, we have to achieve that, and the role of P&O professionals are very important. In that sense, we have to enhance in the direction, and we have to move in the direction of specialization also, and we have to start our specialized courses in the prosthetics and orthotics itself. In that, we will take your support and we will take your guidance always. Thank you.
I think there's Zia from Pakistan is also raised his hand on the internet. So.
Hello, sir. Good morning.
Thank you very much, sir, for a wonderful presentation. It is not a question, just a thought came in my mind, and I would like to share with all the audience, especially with ISPO, because you are heading the ISPO. Sir, I was thinking that is it possible for ISPO or for WHO if they can make prosthetics and orthotics as a part of health system? Could we work on this, or is it possible, like, because prosthetics and orthotics is I think not a part of health system. I don't know about the Western world, but not in developing our part of the world, it is not a part of health system. Is it possible, can we work on this to make us orthotic prosthetic is a part of health system? Thank you.
Yes, we can. And then if you look at the WHO standard for prosthetic and orthotic in 2017 with the support of ISPO, okay, it is mentioned that it is strongly recommended that prosthetic and orthotic are under the health system or part of the health system for whatever reason, because and it will make more sense. So something that ISPO International with our collaboration with WHO, where we are pushing and trying to have all the country moving in that direction.
Thank you, sir.
I think thank you, everyone. Thank you, Claude, for joining with us today and stressing on the importance of access to P&O service is a human right and it is not just charity. And we also take the message of a P&O service provision should lead the service users to lead a dignified life with self-esteem and enable them to participate in the social life. So with this note, thank you, sir, for joining, and we will move on to the next. Okay, now I would like to call upon guest speaker, Dr. Madhoraj, President, Orthotic Prosthetic Association of India and International Society of Prosthetics and Orthotics India, to share about prosthetics and orthotic procession in India.
Good morning, everybody. That's okay, na? Audible? Okay. Can you hear? Good morning. Good morning, everyone. Okay, okay. It's okay, na? No problem in that. Good morning, everybody. Good morning, Director Abdulna Madam and Ritu Madam and other management staffs and students, those who are in the online. Everyone, I want to say good morning to everyone. I am extremely happy to be here to address the first International Day of Prosthetics and Orthotics. The November 5th of the year declared as International Prosthetics and Orthotics Day by the International Society of Prosthetics and Orthotics. During the International Committee meeting held in Japan, they have finalized the date and they announced a couple of months back. ISPO has announced a couple of months back that the November 5th is the International Day for Prosthetics and Orthotics. It will be celebrated. This is the first year. In continuously, we will celebrate as like other professionals are celebrating the days. So this day corresponds to be the date for the ISPO was established in the year 1970. The ISPO has been established in the year 1970, November 5th. So they fixed this date as a International Prosthetic and Orthotics Day. The first International Prosthetic and Orthotics Day is being celebrated today. We believe it is important through the International Prosthetic and Orthotics Day to highlight and raise the importance and impact for those required prosthesis and orthosis, and the need to provide further resources to ensure equal and appropriate access to prosthetics and orthotic services. The theme for the 2022 International Prosthetic and Orthotics Day is enabling and empowering. I think I don't need to explain about enabling and empowering since the ISP president has explained already. So prostheses and orthoses are externally applied devices and products used to assist people with physical impairments or functional limitations to improve their functioning and increase their potential to live healthy, productive, independent, and dignified lives. After the World War II, the development of artificial limb and its research expanded across the world. In USA, the National Academy of Science, NAS in 1945. In Great Britain, the Limb Fitting Center of Queen Mary's Hospital, Roehampton. In early 1970, research in Germany seems to have moved from the university to the private manufacturers. The thalidomide tragedy prompted the Swedish government to expand the research and development work and technical aids for the handicapped in 1962. During the 1960 and 1970, the French government expanded its support for artificial limb research in India. The first artificial limb center to be set up in India was the first artificial limb center established at Pune. The Artificial Limb Center established on 19 May 1944. It moved to Kirki in 1945 and there to Lahore in December 1946. However, after partition of the country in August 1947, the center was re-established as it is present location in Pune. On January 1st, 1948, initially the center was established with the aim to provide rehabilitation aids to disabled soldiers of Second World War. Later on, in 1952, the services of Pune Artificial Limb Center extended to the civilians also. A center for civilians was started the first time attached with All India Institute of Physical Medicine Rehabilitation, Mumbai. That time it was Bombay, 1958. Again, the Tamil Nadu government has set up the Artificial Limb Center in 1963, attached to the Department of Orthopedics, Government General Hospital in Tamil Nadu. That was the first artificial limb center started by the own in the state government in India. Subsequently, centers were started New Delhi, Calcutta, Lucknow, Baroda, Patiala, Meerut, Bangalore, Ajmer, Vijayan, Manipal, Mangalore, Trivandrum, and Calicut everywhere. In 1973, a policy decision was taken by the then Prime Minister Mrs. Gandhi, initiated for setup of Alimco by diverting the fund from Army. The company came into existence in November 1973. The production of components for artificial limbs finally started in a modern plant and sophisticated equipments at Alimco, Kanpur in 1976. Now the Alimco is doing better in collaboration with Autobag, and everybody knows about the Alimco's products and their involvement in the prosthetic and orthotics profession now. Now I would like to say about the P&O as curriculum. The prosthetics and orthotics professional courses are being taught in undergraduate and postgraduate levels under different universities throughout the country as per the guidelines of Rehabilitation Council of India. There are 4 national institutes under Department of Empowerment of Persons with Disabilities, Ministry of Social Justice and Empowerment, SV Nirtar, Cuttack, NILD, Calcutta, and PDIUD in New Delhi, and NIPMED in Chennai, and P&O academic program similarly in AIPMR, Mumbai, and VMMC Safdarjung, New Delhi, under the Ministry of Health and Family Welfare. Government of India conducting P&O courses in those institutions. Apart from that, there are state universities and many private colleges and the NGOs are running the P&O courses. Out of that, I believe that, not to praise the Mobility India, I believe, as I have seen so many institutions, maximum I have covered all over the country. As far as my knowledge, I don't believe it is NGO or private institution. It is like a family. Those students so many students I met who have passed from your institute, they are not telling that Mobility India is separate and they are separate. They are like your family members. But where I studied in my Madras Medical College, I won't say like that, because you are brought up is like that. That's why I appreciate the Mobility India for this. Not for stage, I am telling, from my heart, I am telling this word. Students may realize that things. In India, there are totally 5 central state government institutions and 6 private institutions offering P&O courses under approval of RCI. The best endeavor of P&O professionals bringing smile on the face of physically challenged persons. Besides the rehabilitation of Divyang, they work hand to hand with other medical professionals for the treatment of orthopedically, neurologically affected patients. Now I am coming to the census of what I am getting the census from the sources. As per census 2011, there are around 54 lakhs in 2011 people with locomotor disabilities in India. Number likely to increase by in 2020-22 by 10% of total population as per WHO, and may need the services of P&O professionals. However, total registered professionals in India till 2022 are less than 5,000. You think about the total disability population and the professionals available in India. But our professionals, those who are studying, I'm frankly telling that don't mistake me. If you mistake, also no problem for me. Why I am telling? No, I am doing my private practice. I completed in 1979, and I am from the very basic family only, not from rich family, as Rita has told. My father is a teacher. Simply, I started my clinic in Salem those days in 1980. So many students might have not born that time. So I started. Now I am running my clinic with a lot of struggles. Those days, one rivet I cannot get. For 400 kilometers, I had to go to Chennai for fabricating one small caliper. If I get the rivet and some small materials, like that we were suffering. Now everything, it is available on the table for you. Now you can utilize these chances and try to serve the disabled persons. As soon as you complete the course, you don't think for the going for government job or don't think for some other imagination. You be confident on your own. I can do. I can work for the disabled person, whatever cases it may be. It may be below knee or above knee or through knee, whatever it is. I can do. Since you are in good institutions, they are teaching very good. So you get the confidence and don't try always, because wherever I am going, everybody is telling that all the P&O students, what I am feeling that everybody wants to go to the government jobs. We are also trying through the association, we are trying to establish the district rehabilitation centers all over in Tamil Nadu, we have 34 districts. Even in all 34 districts, we have the district disability rehabilitation centers. Only in the Tamil Nadu, there are 27 prosthetic and orthotics professionals or district disability rehabilitation officers as per the deputy collector cadre. 27. So no other districts we have. So we want to implement the same scheme so that it can be reachable also easy for the disabled persons in different states, all the states. I am telling about all the states. So we are trying through our association, we are explaining to the government, and we are on the way almost 50% the government has understood. Instead of keeping DDRC in 100 places in the country, better if they establish in the state. Each district, if they in the headquarters, if they have the P&O department, at least our professional also will get the job, as well as the government also will give the latest technology materials to the disabled persons, those who are really in need of that. Those who can offer the money, they can go to the private clinics. That's what we are explaining to the government of India. Government of India also, it is there in the consideration of this, our scheme. This we are trying seriously with the government of India, with other states also. That's why I am telling this census. Out of 5,000, 3,077 are bachelors, BPO, 185 are masters, and 500 are diploma in prosthetics and orthotics in our country. Around 5,000 prosthetic and orthotic professionals only available. Very limited. We need more P&Os, more colleges, more educational institutions, so that we can handle the patients very closely. That's what we feel. So I am coming to final. The main objective of celebrating this International Prosthetic and Orthotics Day on November 5th, 2022, to extend this tremendous success of the prosthetic and orthotic treatment to the general public persons with disabilities, and try to, my advice, don't take it as advice. As a senior, as I am, I suffered and I enjoyed a lot with P&O. My sincere advice is, you have chosen a very good course. As Ms. Reeth has told, I also joined in BSc Mathematics. I studied 6 months. Then after that, my father has joined in this course. I was joined there. Then after 2 months, I left the course and I have gone to my home. After seeing this leg and hand and all these things, it was lying. So it is very new to me. So I went back emergency period, 1976. So again, with so many restrictions, they readmitted me in the college. Because I told my father, I won't go, I cannot study this course. But after that, in emergency, it was too much of conditions. So my father came and they joined me. All 3 years, I got the first rank and got awarded in my institution. Normally, I study well during the student period. So I got the government opportunity also, but I don't want to go there. It is my personal this thing. Because all of my family members are in government sector. I don't want to go. So God has written that I'll have to suffer something. Then after that, enjoyment God has given. I am so comfortable now. Because all my classmates, why I am telling all these examples is not to kill the time. At least you people should listen that. One time you will think, one man has told like this. See, all my classmates, those who are with me in school as well as college, they were in the good position. That is, bank managers, and somewhere in the electricity board, somewhere in the other public department, and the other, they're in the good position. But they are not served for any deserved persons. They served for their own family only. But I am so happy because for around 43 years, I helped a lot of people in my personal capacity. I have one NGO also. Through that also I help a lot. So I am fully satisfied because of prosthetic orthotics I have studied. So be happy that you have chosen a good profession, that is good course. Life will be very prosperous and you have very good bright future. Don't worry about that. All doubts you clear now itself from your mind throughout. Okay. I believe that rather than size of programs, the size of participation and reach would be more meaningful and praiseworthy. Once again, I thank everyone for giving me this opportunity, especially the Adbina Madam and Rita Madam for this. And I wish all the students very best. And once again, happy International Prosthetic and Orthotics Day. Thank you very much.
you, sir, for that inspirational speech and sharing your life experience. I think we cannot get these experiences in your website or in the books. I think thank you for sharing your experience with us, and definitely it will benefit our students present and the participants here. As we are running out of time, sorry, we may not be able to take the questions now. So we will move on to the next.
Everyone at Mobility India. First,
we are going to have a video glimpse of Ms. Marika, Executive Director, Miblu, Switzerland. She is a donor, friend, well-wisher of Mobility India. A video glimpse from Ms. Marika.
First of all, I would like to wish you all a very happy first International Prosthetic and Orthotic Day. This day is a very special one. To us all, it is now 27 years that Miblu has accompanied Mobility India working in this field. On this long journey, we have tried to help enable and empower people with physical impairment so they can all have a better quality of life. So we can prosthetic or not, that those people in need gain the access to appropriate services. So congratulations to all. Continue your fantastic job. I wish you all a great day. Goodbye.
Thank you, Ms. Marika, for sharing your wishes to us. And we require your continuous support. And next, I would like to call upon Mr. Sukhdev. He's joined online with us. President, P&O Society, Nepal. And I would invite him to share a few words to the gathering. Sukhdev, are you there?
Yeah, yes, ma'am. Thank you, ma'am. Very good morning. Namaste
Mr.
from
Sukhdev?
Nepal. Yes, ma'am.
Yeah, over to you.
Audible for you?
Yeah, I can.
Hearing me?
Yeah, we can hear.
Yeah, thank you, ma'am. Very good morning. Namaste from Nepal. Thank you, Mobility India, for giving this opportunity to wish first ISPO International Prosthetic and Orthotic Day. My name is Sukhdev Paurel, President of Prosthetic Orthotic Society of Nepal. Thank you, ISPO President Mr. Cloud, to launching first International Prosthetic and Orthotic Day with the global theme of enabling and empowering. I wish to congratulate to ISPO India, OPI India, ISPO Pakistan, BSPO Bangladesh, and congratulate to all the global prosthetic and orthotic service provider and professional and physical rehabilitation stakeholder, WHO, ICRC, and Handicap International, and other stakeholder, related stakeholder who works in rehabilitation sector, physical rehabilitation sector. It is great meeting with Mobility India to celebrating the first International Prosthetic and Orthotic Day. Thank you once again, Mobility India and Ritu ma'am. Thank you very much. Thank you.
Thank you, Mr. Sukhdev. And we are proud that he's Mobility India alumni graduate as well. One more big round of applause. Okay, now just one more video glimpse from Ms. Catherine Holloway, Professor and Academic Director, Global Disability Innovation Hub.
Hello, everyone. This is Kathy Holloway, I'm currently in San Francisco and I'll be on a flight, unfortunately, to London later today, so I won't be able to join with you. I just wanted to say from everybody at the Global Disability Innovation Hub, congratulations to Mobility India for this wonderful day. It's brilliant to be having the discussions that are needed to ensure people get the prosthetics and orthotics they need, and to hear from the wonderful expertise that exists in India on this subject. I'm really sorry I can't join you today. I wish you the very best of luck. Take care. Hello everyone, this is Kathy Holloway. I'm currently in some.
Thank you. And I think we have just two more. I think our Mobility India students sharing about the P&O service provision and wishes on this International Prosthetics and Orthotics Day.
And orthotics colleagues of mine. Happy International Prosthetics and Orthotics Day. We are honored to celebrate this day for the first time on the 5th of November. Let's start by bringing out that if doctors can save people's life, prosthetists and orthotics can make it worthwhile to live. On this occasion, I would like to thank each and every prosthetist and orthotist for the hard work they are doing on the behalf of all doctors, nurses, medical technicians, and everyone working in the medical field.
Prosthetics and orthotics enables people with physical impairments or functional limitations to live healthy, productive, independent, dignifying lives and participate in education, the job market, and social life. At Mobility India, we communicate with patients while we provide them with care, learn about their medical history and any relevant circumstances, as well as conduct the necessary examinations on them. Finally, design the best device for them using the all.
Hi, my name is Vishnu. I'm graduated with a Bachelor degree from Mobility India. Today, we will have a talk regarding the series of steps taken from the moment we will tell the general information of the patients like name, age, gender, address. After the required informations are taken, the patient will be handed to the assessment room where subjective ability assessment will be taken. Afterwards, we reach the casting room where cast of the patient's limb will be taken care. be evaluated.
I think thank you for that wonderful video. I think we have various wishes similar in line, which we will be doing it. So now we will move on to the next. Before breaking for the short break, just one session to go on. I would invite Ms. Chandini to please chair for the next scientific session. Chandini, working as a P&O trainer at Mobility India. Welcome, Chandini.
Thank you, ma'am. Thank you, ma'am. Voice is full. Okay. A very good morning and happy first International Prosthetics and Orthotics Day to one and all present over here. So at first, I would like to extend my gratitude towards the Mobility India for giving me this opportunity to be a part of it and to be a chairperson today. So now, moving on to the next of work-related musculoskeletal disorders among P&O professionals in India. So the author of this presentation is Ms. Minakshi, who is working as an assistant professor at Mobility India Rehabilitation Research and Training Center, and she has experience of over 16 years. She is a part of training department and she is involved in different activities in the training department. The presenter is Ms. Kajal Sharma, who is a RCI certified. To please present your PPT and share the knowledge among us.
Good morning and wishing you all a very happy International Prosthetics and Orthotics Day. And thank you Mobility India for giving me the opportunity to share my views on the topic, prevalence of work-related among prosthetics and orthotics professionals in India. So the musculoskeletal disorders are the injuries or the disorders that affect the muscles, ligaments, tissues, bones, or nerves. And when these conditions are due to the work environment or the work demand, it will contribute significantly to the musculoskeletal disorders. And there are, as per the WHO, so the etiology of WMSD is multifactorial, means it is linked to physical hazards, psychosocial hazards, or the individual factors. So the studies have found that the physical and the psychosocial hazards may lead to a higher chance of WMSD occurrence in the prosthetics and orthotics professionals. But still, if we'll see, there are very limited number of studies that find the prevalence in the P&O professionals. But still, and the Indian data is still not available. But we can see the prevalence in India, it can be equally or it may be high because of the high, like more incidence of the heavy loading and frequent manual loading and all. So this study aims to determine the prevalence of WMSD, and it is to find the association between the demographic variables, physical and psychosocial hazards with the discomfort. Moving on to the methodology, we'll see. So the study's design is the cross-sectional study design was used, and the study subjects are the RCI certified P&O working professionals in India, The sampling method was used as the convenient sampling, and the sample size is 120 as per the inclusion and the exclusion criteria. So one by one, we'll see the inclusion and the exclusion. So RCA certified P&O professionals and working experience of more than 1 year. They are free from physical illness or the disorder, and currently working as prosthetists or orthotists are included. And those who are engaged in only the technical or the administrative roles, or having the history of physical trauma, any diagnosed case of degenerative disorder, inflammatory disease, congenital anomalies, cardiovascular, or severe pulmonary disease, or orthopedic surgery. So they all will be excluded from the study. The data collection was done using the questionnaire that was made in the Google form, and it was sent to the WhatsApp. Then the outcome measure was selected as a self-constructed questionnaire. So the questionnaire was divided into 5 sections. So the section 1 is having the introduction, the consent was taken, online consent, and the RCI number. And the second section was having the socio-demographic variables. The section 3rd was constituting about the pain and discomfort measures due to WMSTs. And section 4 and 5 are having the physical and the psychosocial hazards to find the association with the discomfort. And the data analysis was done using the SPSS in both descriptive and the analytical analysis. Now moving on to the results, first we'll see the socio-demographic characteristics of the participants, like the questions regarding the gender, the distribution of qualifications. So mostly the 64% of the participants were male, and the distribution, like in the qualification, the 61% were the BPOs and 34% around are the MPOs in the study. The experience, around 51% of the participants were in the age experience of 1 to 5 years, and 53% of the participants were doing the regular exercises. And the type of work setting, if you'll see, around 30% were the private clinical practitioners doing in the multinational companies, and the 23% are doing the private clinic as an independent practitioner. So we'll see the influence of all these factors on the discomfort or the pain. Moving on to the prevalence analysis. So as per the results, in the last, if we'll see in the last 4 weeks, the prevalence was found around 92%. And if you see the result of last 12 months, it came around as high as 95%. So we can see the very high prevalence of WMSD in the P&O professionals. And if you'll see like around 50%, the trend is showing around more than 50% of the participants felt pain or discomfort at one or the other body region, like neck or the upper back or any other region. Now, next. If you see the prevalence of WMSD as per the body regions. So most of the affected body region is the low back, having the percentage of around 80%. It means that 80% of the participants having the low back pain in the last 12 months. And it is followed by the neck pain at around 68% of the participants. So the same trend is showing in the prevalence of WMSD in last 4 weeks also. Now we'll see the association of the site-specific musculoskeletal pain with the demographic variables. So if you'll see, there is a significant association between the gender and the lower back. So the result shows that the females are having the more prevalence in the low back pain. And if you'll see with the exercises, like those who are doing the regular exercises, they are having the less prevalence of WMSD in the lower back, knee, and the ankle. Now we'll see the association between the psychosocial and physical hazards with the discomfort. So these 3 factors, the job satisfaction, work-life balance, and the workload, it is showing the suggestive significance with the discomfort. And if you'll see the physical hazards like lift or carrying the heavy things, twisted or awkward postures, or holding or gripping things, that is also having the association with the discomfort. So whoever is doing these activities, they are more prevalent to the discomfort or pain due to WMSDs. Now we'll see the impact of WMSD. Why we need to focus on work-related musculoskeletal disorders for our profession. So it shows that in the last 12 months, almost 15.8% of the participants took leave due to the pain or discomfort they are having, and 28.3% had visited the doctor due to pain or the discomfort. So it is having a huge, because it may lead to absenteeism or their ability not to able to work in the clinics. So the discussion is like there is a high prevalence of WMSD among the Indian prosthetists and orthotists. And if we'll compare the results with other countries, like in Australia, it came around 80%. In Korea, it found around 70%. And in Bangkok, it came around 63.2%. But the study, like the results in our study that came around 95% in last 12 months, this data was supported by the epidemiological studies of India that indicated the occupation specific. The WMSDs were more prevalent among the younger professionals having less than 5 years of experience. It may be because the senior professionals are more competent in overcoming the physical stressful situations and by using the selecting coping strategies. And in the results, we have seen that low back pain is the most affected region, that is followed by the neck, feet and ankle, knee, and it suggests the association between lifting or carrying the heavy things, long time standing, repetitive movements, or awkward or twisted postures. So the results have found that there is a range of work-related physical and the psychosocial factors that are associated with increased risk of reporting WMSDs. And these factors impact the individual's ability to do their job and may lead to absenteeism. So it will be concluded that the high prevalence rate of work-related musculoskeletal disorders in the Indian prosthetists and orthotists is a big concern to the profession. And the work-related musculoskeletal disorders, it may lead to absenteeism, loss of work, loss of long-term disability. So we have to minimize and prevent and to increase the social and the economic benefits. And this study, it is an initial investigation to provide the baseline information and to bring the awareness regarding the work-related hazards. So the future recommendations are like we need to focus on or develop the prevention strategies to address and limit the hazards to the professionals. And there is a need for the prospective study for further explanation of the work-related risk factors. To develop targeted prevention requires for systematic identification and then control of the relevant workplace hazards. As today we are celebrating the P&O Day and we are talking about the upliftment and the betterment of the profession, we also need to focus on the professionals because they are only making the profession and they will lead the profession to the other extent. Thank you so much. These are my references. Thank you.
Thank you, Kajal, for your knowledgeable presentation. So anyone, if having any questions or any suggestions, you are free to ask or you are free to share. Online and offline both.
Hello. Hello.
Yes, sir, you are audible.
Yes. Thank you for giving me opportunity. Nice presentation. I think whatever study you have done, you have reported the data from Australia, Canada, and other countries. In whole country, I have gone through the website and found a research paper done by Australian prosthetics and orthotics professionals at what are the impacts and hazards of the environmental hazards, chemicals, reactions, and their hazards to the P&O professionals in all the setups of different P&O workshops. Have you studied in that aspect also? Because work-related musculoskeletal disorders are associated in the environment in which we are working. 30 years of after experience or 10 years working in the noise, like riveting, like hammering, it affects our ear also. It affects our, in the lamination purpose, it affects our skin also. Have you studied in that aspect or not?
So actually my study is a cross-sectional study, like to find the prevalence first. And these factors, it will need the prospective study. So I will be concluding that studies in my future research, sir.
Yes, yes. It has to be considered because impact of whatever the materials we are using in making these devices, it's also suffers. We also are going to get bounce back on us also. For that, we have to follow the norms of the guidelines, follow the safety measures, follow the preventive measures, and accordingly, I think your study will create a milestone for other professionals to work on this direction also. Thank you.
Thank you, sir.
Thank you, sir. Anyone else?
Hello. Thank you very much for your wonderful presentation. And thank you for pointing out the musculoskeletal deformities in our field. I would like to know what would be your suggestions to prevent these musculoskeletal disorders, which are very prevalent in our field?
So actually, we need to focus on the ergonomical things like the table height or most of the professionals, they are working in the long time standing. So we need to see whether we can provide the insoles or something that may lead less pain in the ankle or the foot, because most prevalent regions are the knee, ankle, and the low back. And I have to do the prospective study, so to find the exact risk factors, and then only I can go to the conclusion, sir. Thank you for your question.
Thank you, sir. Thank you, everyone. So over to Vanilla, ma'am.
Thank you, Chandini, for sharing this scientific session. And once again, a big round of applause to Kajal for that wonderful presentation. So now we are going for a very short break. And we expect you all to please join sharp 12:15. Thank you. Yeah, it's a 15 minutes break. We request you all to join on time. Okay, once again, welcome all of you. And we would play the glimpses of prosthetic and orthotic service provision and the welcome shared by our students, Mobility India students. Can we play it again?
Dear prosthetists and orthotics colleagues of mine, happy International Prosthetics and Orthotics Day. We are honored to celebrate this day for the first time on the 5th of November. Let's start. Prosthetists and orthotics can make it worthwhile to live. Thank each and every prosthetist and orthotist for the hard work they are doing on the behalf of all doctors, nurses, medical technicians, and everyone working in the medical field.
Prosthetics and orthotics enables people with physical impairments or functional limitations to live healthy, productive, independent, dignified lives and participate in education, the job market, and social life. At Mobility India, we communicate, learn about their medical history and any relevant circumstances, as well as conduct the necessary examinations on them. Finally, design the best device for them using all the relevant information.
Hi, my name is Vishnu. I'm graduated with a Bachelor degree from Mobility India. Today, we will have a talk regarding the series of steps taken from the moment a patient comes to the mobility. So here we will take the general.
Okay, we will continue playing this glimpse for today. Whole day it will be ongoing, okay? Not to worry. Just we can continue with the afternoon session as it's very important now to begin. If we talk about journey, and to enlighten us with this journey, we have Ms. Jaikodi, Senior Manager, Resource Mobilization and Communication, Mobility India. We invite her to share her experience as an orthotic user and now moving on to the wheelchair user. So we welcome Jaya to share her experience with us. Can we give a big round of applause to Jaya?
Thank you, Vanilla. Good afternoon to everybody and wish you all the first International Prosthetic and Orthotic Day. The professions present here and all over the world. I would like to thank you all for choosing this profession because of prosthetic and orthotic and other professionals, many people with disabilities are able to achieve their targets and they're able to do what they would like to do. The best live example is me. So I had got my polio when I was almost 6 years old. And from my childhood, I was with the orthotics, and even till today, I am with orthotics, which is enabling me to carry out my task as a daughter, as a wife, as a mother, and in the profession also with a lot of limitations, but still I'm able to achieve. And I'm happy for that because the prosthetists and orthosists and other professionals like therapists have enabled me to carry out this journey. So in 97, my journey started with Mobility India in 97. So when I joined Mobility India in 97, I was having this, what do you call as an that traditional caliper where it used to be attached with old boots. I do not know the professionals over here would have seen it or not. We were wearing that, which was connected to a rod, and it was too heavy. We never had any opportunities to wear the dresses like what I'm wearing today. It was very traditional, like we can wear only one set of dress. And we had to carry the entire weight of that orthosis along with our own body weight. So when I joined in Mobility India, I was wearing the thing like that, which limited me to do many work. But after joining Mobility India, I was fortunate enough to get a job in Mobility India. After joining Mobility India, I received my first orthotic device, which was so light like a feather. So it took me almost a month to get used to the old heavy caliper to the new orthotic device to wear and then start my journey. After having this device, it really enabled me to carry out all my activities. So I was able to travel. I was able to do all the work in the office, move around, go around. And if you see, this is the thing where for the first time I was into the beach with this orthosis. Many people might be thinking people will connect people who were part of disabled. We never had an opportunity like the way we have the opportunities today. For me, the first, getting into the bus was the first, traveling from my home to another, to the next road also was the first. That all was happening because of the right kind of devices, which I like having friends and moving around, socializing. Those are the things which started on. And this was from the professional angle. I was given an opportunity in Mobility India to be the facilitator where I go meet people in different states to talk to disabled people over there to see how they can also be a earning member and lead a good quality of life. So Mobility India gave me this opportunity and I was able to travel all over the South India and North to go and meet different disabled people and motivate them to start their small income generation or to wear an appliances also. Why it was important for them to have the prosthetic and orthotic and how it will help them in the coming days. As you age on still, if you have your prosthetic and orthotic, what all will be the benefits? So these all were the things what I was doing it. This is my family. My mother, my two brothers. My brother is also with disability. He was also part of Mobility India, but now he's moved on to another international NGO, is working over there. And my sister. So this is my family. This is my husband. This is my daughter. So with the orthotic devices, though I was able to carry out my activity as I was aging and as I was having other health issues, I had to move on from my orthotic. Still, I'm using the orthotic. My mobility has become restricted a little bit. So I had to move from my caliper crutches walking to the wheelchair. I still have that thing, I still hesitate. I never want to go to a wheelchair because I always feel like once I sit in a wheelchair, I will not be walking again. That was the thing in my mind. So it took me a long time. That is when the physiotherapist, doctor, and the P&O professional came together and told like what will be the benefit if I go in a wheelchair and how my productivity can increase by going to a wheelchair. The other part, what was happening is when I was with the caliper and my crutches, even with family outing and all was restricted to me. I could go to a certain level. After that, I was not able to go because of the barriers. So I was not able to climb many steps, or it was not accessible to me. So many times what used to happen, we used to go to a park. I used to sit out, my daughter and my husband used to go inside. As my daughter started, maturing a day, I'm not going. So that was one thing which used to always tell, oh, though we are going with them, we are not able to be part of them. So that was one thing. That's when this wheelchair came to a boon, like, it was like a boon for me. So because of my health issues and my contracture, the way I was sitting, because later the doctor told the people who have polio, they get into a comfortable zone, though they are not supposed to sit in that posture, but as the body goes into that style, we get into that zone. So to make me sit erect, since I am in Mobility India, I was fortunate enough, the professionals over here trained me, and then they made me to sit straight. Sitting in the wheelchair, my work became much more easier. Like I'm able. When I was walking in my crutches and calipers, what used to happen? I used to stay in one place. I used to request somebody to get things, restricting me to do what I want to do. But after coming back to the wheelchair, it really helped me to move around, to carry out all them round, a visitor coming, taking them round to different places, showing them the activities. So this all increased more and more, which I was not able to do when I was walking in my crutches. So after that, I started going outing with my family. That also any difficulty. And now my daughter is grown up, and she also knows how to handle the wheelchair. So she takes me around. So we do go out for parks. We do spend time with, it really helped. And it's really helping me to understand my daughter much than what it was before when I was not able to do it. So this was the day when I got my like 25 years, Mobility India awarded all the people who have worked with Mobility India. So I was very proud to get it with my daughter. It was a real pleasure for me. So this is one. Sorry, I'm becoming. I'd like to thank all the P&O professionals. There is a saying always, the doctors are treated as, God. But it's my personal opinion, I would give that same acknowledgement even to the P&O professionals and the therapists, because doctors save the life, yes. After that, to make us move, to make us achieve whatever we are, it is only the P&O professionals and the therapists. We request every professionals to join hand and carry out their work so that more benefit comes to people with disabilities. Thank you very much.
Thank you, Jaya, for sharing your whole lot of experience with us. And we are proud to have Jaya with us in Mobility India as a live example. What difference a prosthetic and orthotic profession can make in person's life. And we have a real asset example. One more round of applause to Jaya. Thank you for accepting to share your experience with us. Thank you, Jaya, once again. Anybody have any questions with Jaya? Online, any questions? No. Okay, then thank you. Thank you, Jaya. So I think now, okay. Now we are moving on to the next part of the event. Very important. And we have Mr. Chapel Kasnabis, the founder director of Mobility India, and whatever we are here today, it is because of Sir. Thank you, sir, for joining with us today. in this happiest occasion of International Prosthetics and Orthotics Day. Currently, sir is the head of the Access to Assistive Technology and Medical Devices Unit at WHO Geneva. So we would like sir to share with us on the prosthetics, orthotics, and public health. Hello, sir.
Good afternoon. Thank you, Vanilla. Thank you, all my colleagues. Good to see Gia and many known faces in the group. So I'll share my screen for my presentation, okay?
Yes.
And please let me know whether you can see it or not.
Yes, sir, we can see the presentation.
Excellent. So thank you very much for giving me this opportunity, and especially it's a privilege for me being an old orthotist and prosthetist, so to talk about International Day, first International Day for Prosthetics and Orthotics is really very close to my heart. Working after so many years with the different countries, different departments, different organizations, I think there is a big need or big push is required to connect prosthetics and orthotics with the public health. And that's why I have ended up in WHO, because if you talk about public health, you cannot talk without WHO. So how prosthetics and orthotics can be integrated within public health and why? That is the main idea or philosophy behind my talk. So when we say public health, we always say that it's a universal health coverage. Everybody should covered by the health. And it's a 3-tier, in some countries big like India. It's also 4-tier mechanism. At the top is the tertiary care, at the middle is secondary care, then primary or community care. And these services are provided by Ministry of Health. It could be by the central or it could be by the state. Now we have to ask ourselves where prosthetics, orthotics fit within this pyramid. What's the linkage between prosthetics and orthotics and the Ministry of Health? In many countries, prosthetics and orthotics still are not part of the Ministry of Health, or they have a very weak linkage, whereas all the work we do is related to the health. So if we look at the fundamentals of public health, the enjoyment of the, you all know this, highest attainable standard of health is a fundamental human rights. Everybody should have a best possible health. And health is simply not a state of complete physical, mental. Health is not merely the absence of disease or infirmity. Health is a state of complete physical, mental, and social well-being. I highlighted more on well-being because most of the work prosthetic orthotics community does is for the well-being. And if you remember rightly, the SDG, the goal 3 is good health and well-being. But we forget about the well-being because we are so much focused on the preventing disease or curing disease. But as people living longer, you will see in my talk later why well-being is so important. And another fundamental issue is not about prevention versus cure. There's no competition here, or individual versus population health. In WHO, we say health for all, irrespective of where you live, what is your socioeconomic condition, where is your capacity of affordability, but it should be for all. Now, public health scenario is changing. And why the prosthetic orthotics community has to take a note of this change? Because we are no more in the 20th century. In the 20th century, we had a huge load of the communicable disease for prosthetic orthotics community, mostly for polio. But polio is almost disappeared. So many communicable diseases like trachoma and all, leprosy, all are in decline. But whereas road traffic injuries, non-communicable diseases, aging are increasing. People are now living longer in spite of their having any kind of non-communicable disease or health conditions. So the aging will be the major driver of this 21st century. Whatever we do, it has to see through the aging lens. So you have to really understand what in demographically, what is going up, what is going down, and how we can make prosthetic orthotic sector more relevant with the emerging trend. So if we see the demography again, in last century, people used to live shorter. And most conditions where prosthetic orthotics people were engaged was unimorbidity, like polio, like spinal cord injury, like amputee. They always have a mostly mobility related impairments. But in 21st century, now the health sector requirement is more to address multimorbidity. As we age, our different functional domains will get affected. You'll no more have the very classical single mobility impairment, or that too just a part of it. You will have people with multi impairments, multifunctional domain issues. And that's why you have to really think little beyond what we used to do in last century. So 80 demographic for changing an example from Norway, the nearly 75% 80 user assistive technology users are 60 plus. I'm sure if you go to any clinics now, you will see there will be more older people in the queue than the younger people. But 30, 40 years ago, when we started the practice, we used to have more children than the older people. And so all the services has to be very much age sensitive, more responsive to older people's requirement, multifunctional requirement than the single domain, what we were used to do before. And keep it in mind, as the need of the older people is increasing, you have to also think that in many countries, even the service providers' age is increasing. I don't see enough young generation coming into the system. They're mostly the same old people with whom I'm working with last 20, 30 years. They're still doing the similar job. So we have to really see that as everybody age, there's an impact on the functional capacity. So how we can optimize our output, especially for the age-related conditions, we all have to think together. And this thinking only will come if we understand the public health and demographical change better. So in last century, the definition of alma mater on public health, it should be preventive, promotive, curative, rehabilitative. When in 2018, when the 50th years of review of alma mater, we also added palliative. But there's a big gap between promotive, rehabilitative, and palliative. As I said before, in 21st century, people will live longer despite of their health condition. People with stroke, diabetes, cancer, all will live longer. So they will not go straight from the rehabilitation to the palliative care. There will be 20, 30 years life in between. And that's where the assistive care and technology is becoming more and more relevant and practical. So I said the 21st century, preventive, promotive, curative, rehabilitative, assistive, and palliative. Assistive care or long-term rehabilitation, long-term curative care. Because more we invest in the assistive care and technology, we can delay the palliative care part. And as you all know, the palliative care is the most expensive affair. So we can really keep people more productive, active, and free from more requirement of palliative care if we invest more on assistive care or technology. This is 21st century's need. I give you an example of public health and diabetes. We know in Southeast Asia particularly, or Pacific, diabetes is almost epidemic. Majority of people, older people, even younger people are living with diabetes. And the common cause of these people who live with diabetes is the ulcer, foot ulcer. And majority of this foot ulcer is landed or ends up with amputation. So we say today's untreated ulcer is tomorrow's amputation. But majority of this amputation, up to 50%, can be prevented with proper foot care, footwear, and orthosis. But in most countries, the prosthetic orthotic services are not integrated within the diabetic care management. Even if you see the best modules like pain and all for the diabetes management, there's no mention of prosthetic orthotics because there's a disconnect. Though your responsibility is to make the prosthesis if somebody has amputation, but it doesn't come as a continuum of care. There is a break. And many times people say that up to amputation is the Ministry of Health, after amputation is the Ministry of Social Welfare. And but that's the same human being. The same human being's need is half met. And majority of this amputation, we can prevent if the prosthetic orthotics becomes an integral part of the diabetics care or public health management. So more we come closer, we are more effective and more useful. And ultimately the people will be benefiting. So that is why I repeat, we need to understand public health better. Now, in any country, as we showed you before, there's a tertiary care, secondary care, primary and community care. Most countries, prosthetics and orthotics are still sitting at the tertiary level. But majority people live at the community. They go to the primary health care. At the most, they go to the district hospital for their immediate care. And where is the prosthetic orthotic services there? So we really need to understand how we can integrate prosthetic orthotics in this pyramid of health system delivery. So when you have to have a public health, you have to understand that there's 6 building blocks of the public health or health system: leadership, governance, finance, data, which we club together as a policy, because mostly it is controlled by the policymakers. Then we have the products, personnel, and provision. And with this 4P, we made a 5P approach of the system of AT provision or the prosthetic orthotics provision system: people-centered, policy, products, personnel, and provision. And we are very happy, we are very grateful to ISPO to take these 4 colors in designing the logo of the International Day of Prosthetics and Orthotics. So all the 4P is represented by 4 bars along with the P and O. And the slogan "enabling and empowering" is the best slogan I can think of to fit the prosthetics orthotics community. So credit goes to ISPO, and we are really looking forward to further this linkage between the public health and prosthetics and orthotics community. And if most of you know that we developed these standards, which are 60 standards, and we all have a strong linkage with the public health. So now WHO is working on to develop the assessment package based on the standards, which we are expecting to launch on 12th December. And if any of you are interested, we have piloted in few countries. So if you are interested, get in touch with us, because this will give you an assessment and the roadmap where you are today and where you would like to be tomorrow. So I come to the last part, is the WHO Global Report on Assistive Technology. We consider prosthetic orthotics as a key component of assistive technology, and then see the need is increasing. 2.5 billion now, 3.5 billion by 2050. So there's a huge need, but need has not translated into the demand, and demand has not translated into the market. So many of you may be struggling because need has not been recognized and converted into the demand or market. So prevalence of assistive devices, again, from the global report, it says that more age, more assistive products, but the inequity in terms of access from the global south and global north is huge. Even within the country, there's a huge gap between urban and rural population, rich and poor. So I think we need to work together and put our brain together to see how we can do it. So in conclusion, prosthetics and orthotic service is an integral part of universal health coverage. So as AT provision system, it has to be within USC. We need to follow 4 key areas: policy, products, personnel, and provision. With 1P, other 3 Ps will fail. So we have to work on the ecosystem. Keep it in mind, prosthetics and orthotics personnel are health professionals. They have to understand public health. Prosthetics and orthotics personnel need to learn about public health, and other health professionals need to learn about prosthetics, orthotics. Better connection with health sector. We do a lot of work, but we don't invest in data. We need a prosthetic orthotics community also to get more engaged in data collection and analysis. And my sincere request, please publish. If you don't publish, you perish. Prosthetics and orthotic services should be people-centered and not professional-centered. That's my last key message. Thank you very much. We have signed an agreement recently with Ministry of Health India. We are going to sign a similar agreement with other Ministry of Health in Ireland and Egypt. So we want to really connect the AT more closer to the health sector. So we need your support and looking forward to working with you. Thank you very much.
Thank you, sir. I think now the floor is open for the questions. So any questions from the audience and even from the online? Okay, we have a question in the online. Yeah, you can please ask.
Good afternoon, sir.
Good afternoon, sir.
I was your student and meet during the conferences of OPSI last 15 years. After 15 years, I am watching and listening your voice. Very nice to listen your voice and very admired from your speech. Sir, my question or my suggestion this is, we have to include our professionals from RCI to the health professionals in our own country, India. And we have seen the COVID, we have seen the impacts of COVID, and it has given a lot of lessons to all of us that being a family member, we cannot be outside of the health professionals. We have to be a part of health professionals, and we have to be work under strong leadership and under your guidance to achieve the Millennium Development Goals, which has been decided by the United Nations. And I will be happily to join in your guidance to work and learn a lot of new things for the assessment package, which is going to launch on 12th of December. Thank you, sir.
Thank you.
Mr.
I think it's more a comment than, and we strongly agree that you have to really work with Ministry of Health. But to work with Ministry of Health, also you have to talk their language. You know, so you have to really, they don't need to know you, you need to know them. And some of you has to sit in the Ministry of Health, the policy makers office. If you sit in your own clinics or own workshop, it will never happen.
Yes.
If you have to change the system, you have to change where the system starts, originates. That's the policy. I do not know how many of you or the prosthetic orthotics community people are sitting in Nirban Bhavan in Delhi or India or in Islamabad in Pakistan. So unless and until you reach there where the policy originates, you will not be able to change this. And also you have to see, with many course curriculum in past I have reviewed, this public health is not a major subject in the prosthetic orthotics education. So if you do not have that, how can you argue for the inclusion? So you need to really rethink about this whole, and it should be embedded into the prosthetic orthotic education. And the same way components of prosthetic orthotics should be embedded in the medical education or other paramedical education. You need to talk the same language, otherwise it will never be included.
Sir, I think we should be included in the Masters of Public Health and Administration courses. That will give our scope very much advanced in our own country and worldwide also. It should be included in that also.
So many prosthetics, orthotics graduates and postgraduates should do the masters or the PhD related to public health. And once you have that, then you can reach to the highest policy level, you know, in the ministry. Yes, unless and until you sit in the ministry or the policy makers table, you'll not be able to influence the policy.
Yes, so that is the lacking point. We are facing a lot of problems due to that.
You can be the boss of your own family, your own children and all this, but you cannot be the boss of everybody unless and until you have that everybody's language, blessing, commitment, support, So we need to work with partnership, not in competition, with other professionals to see that people's interest. That's what I said. We have to look at the people's interest, not the professionals' interest. And that's the key message of the public health. We have to look for the public's benefit, public's health.
Thank you, sir.
Thank you.
Thank you, sir. I think we have one more question from Mr. Mrityunjay, sir.
Good afternoon, sir.
Good afternoon.
This is Mrityunjaya. I'm a guest faculty here in Mobility India. I just wanted to convey my greatest appreciations for this presentation, sir. You were using P's and I use C's here. Crisp, clear, and no confusion. So I don't have any questions to ask you. The presentations were wonderful. And personally, basically, I'm an engineer associated with Mobility India for the past 8 years or so. After my retirement from the industry, I'm focusing more about industry institute initiatives. So I have tried to do a bit of my support to MI, sir. So the presentation has motivated me even more to involve and contribute more to the P&O field. So basically an engineer, whatever from the engineering angle that is there, I would like to contribute and continue my support to the institution. In that angle, your presentation has helped me a lot. I would continue with that, sir. Thanks a lot. Thank you.
Thank you very much, and special thanks for engineering coming to support prosthetics, orthotics work or public health. Last month I was in Chennai and meeting was organized by IITs. And they're all engineers. There is no health professionals in the meeting, hardly any. So this, again, there is a silo. Engineers work on their silos. Medical professionals work on their silos. Prosthetic orthotics people work on their silos. But people do not understand, or they don't want to recognize, I do not know for why. If we work together, then only people will benefit. This silo approach actually killing people's initiative, their potential, and their contribution. So engineers, means we try always, the engineers, doctors, paramedics, all has to see has a one goal, public health, people's health. How we can contribute together and break the silos, to really for the people's good. And thank you for your cooperation and partnership. And I really appeal to you, through you, influence your community to understand public health, because without engineers, many things what we are doing, it will not happen. So thank you very much.
Thank you, sir. I appreciate, and I would like to involve more with my colleagues as well. Thanks a lot again, sir.
Done?
Thank you. Any more questions? Okay. Yeah, one more question from Ritu ma'am.
Thank you, sir, for this, giving time to present this and enlighten us. So you, in the last slide, you shared that you had, with the Ministry of Health in India, you had signed an agreement. So how this agreement with WHO will take this, what are the activities will happen under this agreement?
There are few key deliverables in the part of this agreement, Ritu. And one, of course, when we have done it, we have kept it under umbrella of AT. What we are trying to see that how the Ministry of Health can take more active role in promoting the assistive technology sector, especially the provision part. So we are trying to see that how what Ministry of Social Justice or Social Welfare should do, what Ministry of Health should do, what Ministry of Industry, small and medium scale industries should do. So all different ministries has to work together. They cannot work in isolation. So with this Ministry of Health, actually we have agreed the MOU with the Department of Health Research or Indian Council of Medical Research. So they have a lot of health related research work and the pilot programs which are more innovative types. So we want to see that how assistive technology, prosthetics, orthotics, all are get included into that medical research, medical education. And besides, the biggest one is that rural health promotion or rural health services, how we can include this. Of course, there is also bigger picture, like India wants to become the assistive technology hub, to promote campaign in the national level and global level to promote assistive technology in a big way. So, but what we are really keen to see that how the health workers, primary health workers, the health professionals, doctors, nurses, especially the nurses, how they can learn a little bit about prosthetics, orthotics, physiotherapy, or other assistive products, so they can deliver this at the community level. So how to connect between the tertiary to community, this will be the main idea or main motive behind. There are two, it's a twin-pronged or twin-track strategy. One, to give the necessary policy and advocacy support. And second, how to make the services available to the people living in the last miles and document it, model it, so promote for the larger implementation in future. Ritu, is it clear?
Yeah. Thank you, sir, for the clarification. Yeah, thank you. Over to you, Vanilla.
Okay. Thank you, sir. Thank you so much for joining with us. And we take the key message as assistive technology to go up to the primary level so that it reaches to the people who are in the need, and the need for, and how it has to be done, working very closely with the public health, and the need for the multi-sectoral collaboration in this process. So thank you very much, sir, for joining with us. Once again, a big round of applause to the sir. I think before ending, we have one more glimpses of wishing us today is by the President IET, Mr. Prakash Mehta. Can we have the video glimpse?
Hello, friends. It gives me immense pleasure to be a part of this great event of the first World Prosthetic and Orthotics Day today, announced by International Society of Prosthetic and Orthotics. As the former president of International Society of Prosthetic and Orthotics, India National Member Society, and the president of Indian Association of Assistive Technology, the first multidisciplinary national body of health and allied health professional in the country and region, it is my duty and responsibility to usher this great day. I couldn't have thought a better platform than being presented by Mobility India Rehabilitation Research and Training Center, hosting this event with various other stakeholders. My association with Mobility India dates back to more than 25 years now. So Orthotics started the organization of national and international importance in the field of assistive technology. It gives a feeling of great pride to see that today Mobility India has given this country the first ISPO categorized course and in helping creating of high quality professionals for the region. I remember as the president of NMS of ISPO in India, they had a long discussion with the then president of ISPO on the topic of why the world does not have a P&O day designated. I was very keen on this necessity, and today, after years together, this gets realized. It seems to be a personal victory for me and all the professionals associated with the E8 family. I would further reiterate that 5th November being marked as the World Prosthetic and Orthotic Day, the scope of assistive technology and its impact in the world today has strengthened manyfold in a country like India and various developing nations. We feel that a strong prosthetist and orthotics base is the mandatory gateway to the glorious world of assistive technology. I once again congratulate Mobility India for the great work that they have been doing through decades and wish this organization continue growing in the right direction of providing holistic solutions to multidimensional challenges and rehabilitation and healthcare in the field we're facing today. I wish the program all success. Thank you for this wonderful association and opportunity given. Jai Hind. Hello, friends. It gives me.
Vanilla. Rajdeep is also, I think, from Ghana, if he can.
Yeah. Is this video done, Nayas? Okay. Okay. So now we will also have Rajdeep sir, who is presently in Ghana for a project. Can we have Mr. Rajdeep to wish us on this Prosthetic and Orthotic Day? Is Rajdeep there?
Yeah, good morning, everyone. Actually, in Ghana, it's a morning, and I know India is a afternoon. So, good morning, everyone. It's I just was complete presentation. I was listening to Chapel sir. It's very, very nice presentation, and it's always good to listen Chapel sir. And today is the first International Prosthetic and Orthotic Day. So I wish all professional, all my colleagues, all students, wishing all everyone happy International Prosthetic and Orthotic Day.
Thank you, Rajdeep, for joining with us. And
so, Vanilla, you can
you.
tell that you can tell what. Okay, just for the audience, that Rajdeep is in Ghana in involving in setting up the workshop there and making the workshop, P&O workshop, functional and training the local prosthetist and orthotist, the specialized training, so that they can make the services operational. So thank you, Rajdeep, coming from Ghana and sending a messages from there.
Okay, thank you, ma'am. One more small glimpse, short glimpse by our CCRT students before breaking for lunch.
Today we are all celebrating the first International P&O Day. Happy first International P&O Day. Today we are all celebrating.
Okay, so I think we break for the lunch, and we request all the online audience to join us sharp 2 p.m. and we close. And before that, I request all of you all present in the hall to have a group photo. And we'll have a group photo and then we can move for the lunch. Okay. Thank you. request everybody to please join us on time at 2 p.m. 2 p.m. Mr. Vinith.